Hello, everyone. Sorry I didn't announce this live, but I wanted to, jump on really quick. And as you see, what I want to talk about is the acute chest syndromes that a lot of sickle cell patients actually suffer from. So I wanted to discuss that a little bit, as well as, sorry, I'm trying to log back in something. Also discuss the spleen enlargement that we've also been dealing with as well. Again, just to throw it out there, I'm not here to diagnose, treat anything. I'm just giving you general information so we can enrich your lives and basically help you live a much more full and rich life as well. So again, you can give me thumbs up, shout out, ask me any questions while we're going along here. But I mentioned this research some years ago. And then I brought it back up again the last few months. I try to really bring this up during the winter months, especially because of the fact that a lot of the viruses that sort of go around about taking the zinc. The zinc, I actually put out a document on this forum as well concerning zinc and how zinc really works inside the body to improve the immunity system, as well as there's some great research that shows that zinc has been able to reduce the rate of acute chest crisis. Acute chest crisis is a crisis that's really centered around the breastplate area. Many of you who've experienced it, or had a child or someone, a loved one who experienced it, you know exactly what we're talking about. The pain will wrap around and be in their entire chest area. But there have been several reasons for this actually occurring, and the research has actually been a very old research, which sort of has made me emotional about even wanting to put this out, only because of the fact that a lot of information has been put out there. Been withheld from individuals because some simple treatments have been withheld. So let me try to explain a few things. Usually when someone has an acute chest crisis is due to a upper respiratory infection or the beginning of an upper respiratory infection. And there's different, gram-positive or bacterias and things of that sort that actually create these bacteria that cause the chest crisis or infections inside the chest. Now let's go ahead and rewind that. In 1964 through 1967, there was some research being done because they were noticing that in sickle cell patients, when they were testing the blood and also testing the urine of sickle cell patients, trying to find out what's really going on, they noticed that in their blood, there wasn't a lot of zinc as well as some other trace minerals. But if it was looking at the fact that when they were urinating out a lot of zinc inside of their urine. So that led to a whole slew of other experiments. Long story short, the majority of individuals with sickle cell disease actually leach out too much zinc. What's the importance of zinc? Well, anyone who's ever watched any of my videos know that I talk about zinc and other trace minerals a lot, but more importantly, zinc is in charge of about 300 different enzymatic processes inside the body. One of them being in charge of a thymus, which is actually inside of the, if you see where I'm putting it right now, I'm putting this behind the breastplate is where your thymus is actually located. Thalamin is actually one of the main chemicals inside of the actual thymus itself. The thymus is a gland that's in charge of your immunity of your body. Basically tells your helper killer T cells inside your body where to go and what to kill. It's been shown that if you don't have enough zinc inside of your body, you won't be able to produce that chemical to tell the to tell the killer T cells where to go or what to kill and things of that sort. So basically, it doesn't work. So one reason why these individuals or sickle patients have these acute chest crises is that the thymus and also that bacteria is not able to be killed for many different reasons. We can point to the fact that biologically you do leach out a lot of your zinc, and no one has told you really to supplement that. It's always only been, well, take folic acid, and that's basically it. No one has told you to take zinc. Only a few of my patients in other countries, doctors actually tell them to take zinc on a daily basis. Here in the United States, I haven't really seen a whole lot of that. It's been very rare, like I said. These are only like a recommendation from like another naturopath or maybe a doctor who's from a different country will recommend that. So back to the whole zinc thing. So then there were some studies done in the late 70s. again, show more propensity to the fact that individuals, even without sickle cell disease, really needed zinc, especially during the cold months, because again, it helps boost your immune system. Again, it shows that it helps the thymus itself produce these helper killer T cells that helps the immunity in the body. Okay, so why haven't this been really popularized? Because of the fact that it's been several reasons. It's been several reasons because of the fact that, one, we're thinking that, okay, well, versus giving you a supplement, we can just give you something like the penicillin to basically help to kill anything that can possibly happen in your body. But then the research in 1986 and also 1999 has shown that because of the fact that we're over-giving these penicillins and over-giving these antibiotics as a prophylactic, when another bacteria comes inside the body, it's hard for your body to actually fight off all of these bacteria that cause the chest crisis. So, what does this really mean to you individuals? There was some studies done. There's actually 3 studies that was done that showed that they gave between 45 milligrams and 75 milligrams of just zinc acetate to patients with sickle cell disease. Ones who historically would have chest crisis and ones who, as they were coming in, it took a long time to actually do it. But actually, the study is actually in this group. If you go into the files, you'll see this study, one of the studies that I'm referring to. And it was about maybe 56 individuals in this particular study that actually complete the entire thing. So yes, it's only 56 patients, but when you have a 55 out of 65 individuals not have a chest crisis in an entire year, and then subsequently the years previous, post, 3 or 4 years post that, the study, it has to have some sort of validity. So that's why with my patients that I see in my office, or I consult via Skype, or I also do help consulting as well, people that are not in this state or in this country, I always recommend them to be on zinc, at least 50 to 75 milligrams every day. Children, I say anywhere from 25 to 45 milligrams, every day, and that's without fail. And as I tell everyone, before I even had my own zinc, I would tell them to go just get a liquid zinc somewhere and just start taking it immediately. Because one, as a practitioner, I see how it works in a normal individual that doesn't have. The research even shows in a normal, healthy individual without sickle cell disease, if you were to even get a cold, the zinc has been shown to even reduce the length of a cold. So if you're on an average, a person has a cold for 5 days, it reduces the cold down to 2.5 to 3.2 days, basically 2 to 3 days. So it's able to cut it down to almost half just by taking zinc on a daily basis. And then when you have the cold or flu, you can take up to, I think it was 150 milligrams a day, a couple times a day. So it has a lot of validity to it. And it's a very, very simple thing, is zinc. There is some research that shows that if you take zinc, eventually, occasionally you should take a trace mineral called copper, because copper is in charge of actually repairing some of your epithelial cells and things of that sort. If you take too much zinc, they can actually knock it off. So I just want to throw that out there as well. But the point of me even saying any of this, guys, really is just to give you as much information as possible, is to make sure that you're doing as much as you can to stay healthy. One reason why I also put it down is because I've been having a lot of patients that, they've been having these chest crises and their hemoglobin is dropping down. So they've been getting transfused and they've been getting into different protocols that are unhealthy for them because they don't want to be in those protocols. So I'm trying to give as much information out there so individuals will be as healthy as possible. And it shows, the zinc shows the work to help with the bacteria and also the viral infections too. The other thing is a lot of people have been asking about their spleen being enlarged. I'm pointing to this side, which is where the spleen is, but you guys are, the camera's turned backwards, but the spleen is located over here. Anytime you have a viral infection, especially if you go to the hospital, the amount of fluids you're given, and also the fact that they give you a lot of antibiotics and other things, and if you have a viral infection, an antibiotic is not going to work for a viral infection. I don't care what sort of viral infection you have. I don't care if you have mucus and things of that sort of. Antibiotics are just going to prolong that viral infection and or cause more issues. One of the issues, especially with sickle cell patient, is going to possibly enlarge your spleen. I've had several kids between the age of 4, I'm gonna say 3, and up to about 15. I've had questions about this. Not every day, but every other day I have a question about that right there. And every time I say, look, just give it some time, because of course the doctor will go in there and take the spleen out. And I said, no, do not go in there and take anybody's spleen out. Or I don't say no, sorry, because I can't recommend anything. I tell the parents, do what's best, but make sure, your child is actually healthy enough to even accept the surgery. So wait weeks until afterwards. And everyone that's actually has taken my advice, by the grace of God, all of their spleens have gone back to normal, because the body is now healthy enough to sort of reduce the inflammation inside the spleen to help the body actually, fight whatever it is that was going on. So, that's usually the case, especially if it is after a viral infection. I'm not saying just in general, but I'm saying usually after a viral infection, if you get antibiotics and you get a lot of IV fluids, that can actually really affect the spleen itself. So be very, very careful. Just be mindful and don't rush anything harsh and rash. Because again, if you're already in the hospital because you have a viral infection and you're not feeling well and they want to do surgery, you're like, wait a minute, but I'm still sick. How can I still have surgery? Unless it's emergency surgery, of course. You do what you got to do to survive. But if it's not life and death at that moment, please make sure you're healthy enough to accept anything that's really going on. And it's really about just being as healthy as possible at this point. This past, and it's still going on in some states. And fortunately, I live here in Florida, so cold for us is like 78 degrees. 68 degrees. But some individuals, you guys are still pretty cold, and these colds and flus are still, prevalent. It was actually a report put out on Monday. Yes, on Monday. Saying that there's possibly another flu that's going to come back around yet again. There's been some reports that the flu possibly come back around. So, definitely, make sure you guys stay as healthy as possible. Plenty of fluids. Elderberry is very, very good to help prevent and also treat colds and flus. You can do just a lot of ginger. A lot of honey and lemon, vitamin C. Make sure you take plenty of vitamin C. And of course, yes, definitely take your zinc as well. Like I said, I'm just giving you information, trying to enrich your body, enrich you guys' life as much as possible. If you have any questions, please feel free to send me a shout out. I see a few people that's actually online right now. Thank you so much for the actual thumbs up. But again, the whole zinc thing, like I said, when I compile all this information to put it out there, I try not to do it in a way that I'm being quote unquote militant. I'm trying to just give it to you in a way that's digestible and you understand what's really going on. A simple supplement just as zinc, can really save someone's life. Trust me, I've seen it. I've seen the research and I've seen it within my own patients as well, how well these things work. Case in point, vitamin D. Vitamin D is another one that is very, very good for immunity. And I'll tell you the reason why. Vitamin D is a precursor trace mineral that's good for either the thymus or actually the intestines, actually accepting a lot of the immunity that we have in our intestines as well. And it's a quick fact. People with an Anglo background, white individuals, they only need about 15 to 25 minutes of being in the sun in order for them to get the amount of vitamin D that's naturally being produced in their body. Now, individuals that have melanin, African descent individuals or darker skinned individuals need about an hour to an hour and a half to get that same amount of vitamin D. The reason why is because the melanin is blocking those ultraviolet rays that gets the body to produce the vitamin D. So women, the reason why I tell a lot of my women to, go barefaced or at least bare arm, especially even in the winter, as much as possible so you can get that vitamin D production. Have your arm, by the windowsill so you get that vitamin D to produce inside your body. You have to stay in the sun for an hour and a half at one time, but several times a day. I actually purposely move my desk by the window where the sun shines in. So I'm in my office usually between 10 to 14 hours a day. I'm a workaholic, yes I am. But I try to stay as close to the window as I can so I can have that sun hit me just some sort of way so I can get some sort of vitamin D production. And I do try to walk outside at least twice a day. And hopefully the sun is shining so I can get some vitamin D production going on too. At least once or twice a day. You got to do that. These are simple, healthy things you can do to keep your body very healthy. If you look at things with vitamin C in it, everyone thinks citrus, drinking a lot of orange juice. Orange juice is actually very acidic, so it's hard for you to digest that, as well as grapefruit juice. I prefer kiwi. Kiwi has a lot of vitamin C inside of it. And of course, you can have the kale and all the greens that has vitamin C. But the other thing is moringa. Moringa, the reason why I suggest moringa with a lot of my patients is because of the fact that I call it a herbal multivitamin. It basically has almost every multivitamin inside, or every vitamin inside of it. But you can get it definitely in a tea. And make sure that you get the actual leaves themselves. You don't want to get the stems. A lot of tea bags, you're not getting real tea inside there. You actually are getting like stems and little pieces of things. You're not really getting the true flavor of it. So moringa is also another good way that you can take that almost on a daily basis and getting a lot of the vitamins you need naturally. And the key to that is the bioavailability of these vitamins. What tends to happen is, we get these vitamins off the shelf, and there are very few companies that make non-synthetic vitamins. Mega Foods is one of the ones who make non-synthetic vitamins. All their vitamins are from foods. Like their vitamin C is from kiwi and also from citrus. Their their selenium is from I think shellfish or it's different things like that. So everything that they have, for the most part, if the vitamin is from a natural source. Of course, it's processed, but it's not synthetically processed. And everything that I actually have myself, nothing is synthetic. That was one of the main things that I want to do for this community and also for any community that I treat. If I'm preaching natural, I want you guys to actually be able to get as natural from me as possible. Even my fillers, when I first produced, even for years and years and years ago, I was having different fillers inside there. And I was working with a manufacturer that kept changing the filler because I wanted only a natural filler. I only wanted brown rice flour inside there as a filler. That's all I wanted. And they kept changing it, and I just couldn't trust that because, again, some of these fillers can actually adversely affect your stomach and affect your absorption rate. So if I'm affecting your absorption rate, that means you're not getting the full benefit of the herbs going inside your body, and that can actually cause other problems. I don't want that. So you want to look for vitamins that are bioavailable, and that's one thing. Back to the whole moringa, is more bioavailable since it is a herb, so you can actually absorb that a lot faster inside your system too. So again, guys, make sure you stay hydrated. Even though it's starting to warm up out there, you want to start to slowly, get into the spring phase. You still want to have soups. You still want to have broths. You still want to have teas, every morning just to warm your body up. And do not, please, as a sickle cell patient, do not, not have a scarf or a jacket with you wherever you go, because as you know, you go into a cold building and then you go outside and be warm. We don't want to start that hot and cold thing. And what that's going to do is make your muscles contract. Your blood will flow up and will flow into your body, will flow out to your limbs very fast, which can also cause different types of pains too. You don't want that to happen. So again, I'm just trying to give you as much information as I can to actually help heal you and make sure you stay healthy and happy as possible. Again, if you have questions, feel free to ask me, or you can email me or hit me up on this closed group right here. I love this group. The questions we get on a daily basis are phenomenal. The comments that they help that you guys are giving each other. Sometimes I don't even have to answer any questions because you guys already have the answers, and the answers are brilliant and beautiful. And I appreciate each and every one of you guys for being in this group. So thank you so much for that. And definitely give you guys 2 thumbs up for that. So again, Dr. Charlie Ware, if you have any questions, give me a holler. If not, take care, have a beautiful night, and God bless.